countries over a period of 20 years and re-securing that industrial base right here in the United States.
I talk with the CEO and founder of Phlow Corporation next. And pandemic expert Dr. Dena Grayson is back to answer your questions about the coronavirus.
It's very difficult to study these asymptomatic carriers, some of whom are thought to be what we call super spreaders.
As the nation begins to reopen, we take the pulse of America. Why tattoo artists in Texas are arguing they're ready to get back to work.
You know, I mean, we're on that line between an artist and a medical professional.
That and so much more right now in America. This week, United We Stand. Welcome to America This Week, United We Stand. I'm Eric Bolling. Across states have begun lifting their stay-at-home orders, and different types of businesses have opened up with several restrictions. As the country moves into a new phase of recovery, we'll all stand together, and we'll continue to answer your questions and provide updates on coronavirus right here. Many Americans were forced to put important doctor appointments on hold, even for things like cancer screenings. Earlier this week, I spoke with Senator Rand Paul to see if he was concerned about additional deaths that had nothing to do with contracting the coronavirus.
Yeah, I personally have heard of family members who actually had a relative, distant relative of mine or of theirs, who did die from a heart attack and was afraid to go to the hospital. So we have all kinds of cancer screening we do in our country that do a great deal to prevent cancer. Colon screenings, colonoscopy, they've been forbidden. And then also mammograms for breast cancer are two great preventive ways of trying to prevent and treat cancer at an early stage. And I fear that there's a big backlog of all of this, 2 months backlog. The other way we might have deaths from this is by preventing elective surgery at the hospitals. Many of these hospitals are essentially close to bankruptcy. So if we lose rural hospitals, what ends up happening is if you have to drive an hour when you're having a heart attack, some people are going to die on the way to the hospital if we lose these rural hospitals. So really, there's a great deal of damage that's been done to the healthcare system by this. And we've got to open up. We got like a governor in Kentucky who thinks he's, Pol Pot or something. He thinks he's in charge of the entire economy, and we can't open up without his permission. But every day he does that, there's a threat of more people dying, but also realistically a bankruptcy of our hospitals.
His company, Phlow, was recently awarded a $354 million contract by the Trump administration to make essential medicines right here in America. Joining now, Dr. Eric Edwards. Thank you for joining us, Doctor. Let me just set it up with our audience. This is a very, very important process. You've been awarded a substantial grant, and what that is what that's going to do is bring the process back here, the medical supply chain back to the USA. Great idea, fantastic. Hats off to the Trump administration for seeing the importance of getting our medical supply chain away from China and India and back on U.S. soil. Am I characterizing this deal correctly, sir?
You are. This is all about taking a supply chain and an industrial base that we had lost to foreign countries over a period of 20 years and re-securing that industrial base right here in the United States. And I agree, it is fantastic that the Trump administration, their team, officials from HHS, Peter Navarro's office, all of these folks, when we raised our hands and said, we have a solution here, we have something that we need to do right now to help patients who are struggling with COVID-19. We have a short-term solution to get medicines into the stockpile and to make these critical active ingredients. And we have a longer-term solution to re-secure this industrial base end to end. They listened to us, and we got into the process, and it was a long, difficult, challenging process to get through this award. But we're on the other side, and now we're getting to work and making these medicines.
So a couple things there. You mentioned stockpile. I want to get to that in a minute because I think that's very important. So that if we do have a repeat in the fall, like Dr. Fauci and Dr. Birx and others have predicted, we'll be prepared for that, at least medicinally. And will we? I'll ask you that. But first, I want to, more importantly, how dire is the situation right now? How at the mercy of China and India is the United States at this moment?
Well, Eric, we don't even have exact estimates exactly of how dependent we are, but the estimates are upwards of 80 to 90% of our active pharmaceutical ingredients and their chemical precursor ingredients are exclusively made overseas, including primarily in China and India. So I think it's important for your listeners and viewers to know that we were vulnerable long before COVID-19. These FDA drug shortages have existed for years, and COVID-19 just exacerbated them further. So what we've been trying to do with the federal government is, through this award, we'll have, first and foremost, a rapid surge, short-term response to leverage our great partnerships with Civica, which is the largest nonprofit pharma company in the United States, and Ampac Fine Chemicals, who is already producing API. They were producing them for innovator companies. We turned them on to make these essential medicine APIs. They've been a great partner. We've got that rapid surge to get these medicines made before they go into extreme vulnerability or we run out of them completely. We've already delivered over 1.6 million doses of finished medicines into the strategic national stockpile. And we're talking about critical medicines that are used, for example, to get patients on to ventilators and certain pain management medicines, key antibiotics. So it's really critical that, first and foremost, we had that rapid surge response and we turn on this manufacturing and protect and secure and procure as many active pharmaceutical ingredients to get them back onto U.S. soil. And then the second component was begin immediately getting these shovel-ready jobs up and running, build these industrial bases, resecure this end-to-end infrastructure using advanced manufacturing technologies so that we can make sure that we secure America and Americans' future as a matter of national public health security.
You know, I think it's super, super important for our viewers, and we have middle America watching with 44 million households that are going to get access to this show. It's important to understand that $354 million, yes, a lot of money, but a drop in the bucket compared to what COVID-19 has cost the country. Dr. Ezra, I'm going to say thank you to you, and I just want to point out, because of Peter Navarro, because of the HHS, Alex Azar, because of President Trump and Vice President Pence, the reason you are here and we're having this discussion right now is because we're bringing manufacturing of the most essential medical products back to the United States so we're not caught with our pants down, so to speak, again, like we were the first time. As you point out, Dr. Edwards, up to 80% vulnerability to China and India. We're going to say thank you, Dr. Eric Edwards, and the company's called Phlow, P-H-L-O-W, everyone. Hats off to you guys.
Thank you very much. Looking forward to getting back to work and helping to protect and secure America's future.
Coming up next, as parts of the nation start to reopen, what are the risks when you go out to dinner? I take your questions directly to our pandemic expert, Dr. Dena Grayson.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America.
United we stand.
We stand America.
United we stand.
Pandemic expert Dr. Dena Grayson is back with us this week to answer more of your questions about the virus. Dr. Grayson, this week was all about this political football, hydroxychloroquine. I mean, is it really that big of a deal if people want to take it prophylactically to maybe stave off a coronavirus?
Well, Eric, it is an issue because we know for a fact that there are serious side effects associated with the use of hydroxychloroquine. Patients have to be monitored very closely. And to this point, there's really no evidence that hydroxychloroquine has any benefit. So whenever we think about prescribing a medicine, we think about that risk benefit. And when you have a drug that has a known risks associated with it, including fatal risks like arrhythmias, which are abnormal heart rhythms, but no benefit associated with it, I think that, there should be an abundance of caution.
All right, fair enough. On Facebook, Shirley asks, with some restaurants opening up, could the virus be transferred on foods? Now, we've had that question before, but I think we need to just keep updating people. Is there any way this virus can go from human onto the food to human?
Well, the number one way that the virus seems to transmit is via close personal contact with somebody who is infected with the virus, whether or not they have symptoms. So meaning that just talking to somebody and breathing in their respiratory droplets seems to be the most common way the virus is spread. Now, it is possible as well for the virus to be spread by you touching a contaminated surface and then touching your face. So if you're at, for example, a restaurant, the biggest risk is really from things like the silverware or from the staff or other diners in particular who are not covering their faces. But the virus is not transmitted by eating food that's contaminated. It would be deactivated by your stomach acid. So I don't think that folks need to worry about that.
Got it. All right, Mike on Facebook asks, with all the concern about spreading by asymptomatic carriers, I'd like to know how long the virus will survive in someone who is, in fact, asymptomatic. In other words, when do we know someone's a carrier if they're asymptomatic?
Well, Mike, that is an outstanding question. And the bottom line is we just don't know. I mean, it's very difficult to study these asymptomatic carriers, some of whom are thought to be what we call super spreaders, meaning, they spread the virus to a lot of people. And we know that can occur. But, again, these are folks that don't have symptoms. We know that people who do have symptoms can carry the virus and be what we call shedding the virus, meaning they could spread the virus for up to several weeks. So I think that you really have to make the assumption that until proven otherwise, that anyone else around you, once you leave your home, your coronavirus-free zone, they could potentially be spreading the virus.
Oh, boy. All right, Renee on Facebook has concerns about immune systems after the stay-at-home orders. So how long does it take to ruin our immune system by disinfecting everything and isolating ourselves from other people? In other words, I believe, and if I may paraphrase, are we risking a degradation of our immune systems by not having human beings fight this virus naturally?
No, we're really not risking that. I mean, the real risk to your immune system is when you take like an infant that's isolated in a sterile environment. That's not good for the immune system. But even infants, your babies crawling around your home, they're getting exposed to germs all the time. So that's really not a major risk. Vaccines we know work very, very well when they're developed and proven to actually protect. So that's certainly the goal here. And there's been recent evidence over the past just week that shows that there's a lot of hope that we will be able to develop an effective vaccine against this deadly coronavirus. But I don't think that we should worry that sitting in our homes is going to degrade our immune system.
All right, Dr. Dena Grayson, as always, it's great talking to you. I just think of this herd immunity, which is, I believe, is to be the best form of fighting off a virus like this, even better than the vaccine. Very quickly, final thought?
Well, Eric, the problem with the herd immunity is that can take a long time. If we just allow herd immunity to happen very quickly, we overwhelm our health system, and then the mortality rate really spikes up. So I think that most people would say it's sort of a race between the vaccine and herd immunity.
All right. Dr. Dena Grayson, thank you as always.
Thanks for having me, Eric.
Ahead, walking the line between artists and medical professionals. The risks greater than the coronavirus tattoo artists face daily. And a North Carolina cafe defies orders and reopens. The charges the owner now faces and why customers say they'll keep coming back.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person
America This Week, America's fastest growing political show, points out how rough and tumble politics shape opinion in every region in our country. We tell American stories, stories that touch our people, determine our politics, focus on the future of America.
I'm Eric Bolling. Join me for a fascinating look at America This Week. Some states are now in the process of reopening some businesses, but one type of business in Texas remains closed. Alejandra Guzman with Sinclair station KABB explains why tattoo artists have reached out to state and local officials to make their case.
Tattoo artists say they've been left in the dark, not knowing when they will get to reopen, but they don't understand why. They say they've been practicing safety precautions even before the pandemic.
I love tattooing. It's the best job I've ever had.
Christina Green's an artist at Ink Masters Tattoo Studio, says she's been out of work for a month and a half now.
If I'm not able to get back to work soon, then I'm going to be hit really hard financially.
A scary financial situation, putting stress on her family and threatening her future.
I'd probably have to start running up my credit just to pay my bills.
Tattoo artists across San Antonio are looking for answers.
It's just unfair to have any kind of bias towards us because we're tattoo artists. You know what I mean? We're on that line between an artist and a medical professional.
James Delgado, owner of Twisted Tattoo, shut his doors March 24th. There's
a lot of shops that aren't going to survive from this.
He says he's anxious to reopen and bring artists back.
We deal with people that have, they can have HIV, MRSA, staph, all these different things, and to us it's just a normal day at the office.
James says all artists have bloodborne pathogen certifications that are required by the State Department of Health Services.
We know how to handle this. Anything that they have to do at a hospital, we have to do here.
Training and certifications, Teresa Bay, owner of Ink Masters Tattoo Studio, has explained sending letters to state and local officials who have now classified them with sexually oriented businesses, bars, and massage parlors.
We need them to understand how we operate so that they can make an informed decision to let us reopen.
Teresa says, as a business owner, she's concerned that customers are going to seek tattoos from people who are unlicensed.
People are going to start tattooing out of garages and houses. They're going to get tattooed in environments that are not safe and clean.
Tattoo artists say, bottom line, all they want is to know when they will be allowed to reopen so that they can start planning before they lose everything they've worked for. For America This Week, I'm Alejandra Guzman.
Thanks to Alejandra and the team at KABB for that story. Last week, North Carolina moved into phase 1 of the reopening plan, allowing for some businesses to open with modifications. One restaurant owner defied the governor's executive order and opened for dine-in business. Kimberly King with our Sinclair station WLOS was there when police showed up and issued the owner a citation.
The restaurant owner here at Rise and Shine has her supporters. They are back inside eating this morning without masks on. She does face a Class 2 misdemeanor and could face up to $1,000 in a fine and 60 days in jail. We saw an Asheville police lieutenant go inside Rise and Shine Cafe on Merriman Avenue looking for the owner. The neon sign making it clear the owner was defying the governor's phase 1 order and allowing customers to dine in. Hey, Lieutenant. Good morning. How are you today? Did you issue them a ticket?
Yes, I did. I came and I had a delightful brunch.
Jamie Adair from Haywood County heard from a friend the cafe was open.
It's not only the restaurant owner's choice, but I also think it's the customer's choice. If the people don't want to go, then the business owner suffers.
The restaurant owner, Catherine Feathers, cited the officer writing why failure to comply to the governor's executive order. Sir? Can we talk to you a minute? This customer we saw carrying takeout also in favor of the restaurant's position. Supporting the owner of Rise and Shine?
Wonderful breakfast.
We went in to talk with the owner. She declined to comment. The district attorney telling News 13 law enforcement may refer enforcement to administrative agencies where additional sanctions may be appropriate, such as licensure revocation. A spokeswoman for the Asheville Police Department tells us that officers could be back out here today to issue the owner another citation because she has dine-in customers. But police tell us that it is only the health department that has jurisdiction to shut a restaurant down. Reporting from Asheville for America This Week, I'm Kimberly King.
Thanks to WLOS and Kimberly for that story. Ahead on United We Stand, as the fight against coronavirus continues, many wonder when it will be safe for kids to return to school. What one group of researchers is calling on the federal government to do. And social distancing may have put a dent in your Friday night entertainment plans, but one nostalgic activity has been gaining popularity during the pandemic.
United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America.
United we stand.
We stand America.
United we stand. United we stand, we never fall. This perilous fight, it takes one and all. Everyone stands, American strong. Strength by one equals strength by all. American values, American pride. Your neighbor needs you, each person, each time.
We stand America.
United we stand.
We stand America.
United we stand.
As the coronavirus pandemic continues, one big question: will it be safe for students to return to the classroom come fall? A group of researchers is calling on the federal government to fund additional studies that look into that. Liz Ortiz with Sinclair station WBFF explains why they say the research is so critical.
Well, researchers say there is an urgent need for more evidence to support how students can safely go back to school. They want to help states and school officials make the right decisions rather than guessing.
When it comes to COVID-19 and children, doctors are still looking for answers. Answers they hope can help schools make informed decisions about reopening.
As a researcher and as a parent, I really see that going back to school confidently in the fall is critical.
Dr. Tara Sell is a senior scholar at Johns Hopkins Center for Health Security. She is one of the authors of a new report called Filling in the Blanks. National research needs to guide decisions about reopening schools in the United States.
The report calls for a national mandate to prioritize and fund research. And in doing that, we walk through what's known in the science about kids and COVID, and also what other countries are doing right now as they go back to school so that we can learn those lessons.
Specifically, researchers want to know more about transmission and the potential risks of students and teachers returning to the classroom.
We know that kids are not generally affected as severely as adults. They seem to get sick or severely sick much less often. And have severe outcomes much less often. And so we really just need to know how transmissible is this disease from kids to those vulnerable adults.
The report also calls for the creation of a national advisory board made up of pediatric, public health, and educational researchers who can regularly review the science.
I don't want to say that this research needs to be done and it needs to be completed in order for any children to go back to school, but we need to start to make progress on this. Not all the results are going to be done by the time we need to make decisions about the fall, but we will learn a lot more in the next month when we see what happens in Europe with their schools.
Now, when tracking reopenings in other countries, researchers are looking to see if there is any increase in community transmission and if there are any successful approaches that can be applied here in the United States. For America This Week, I'm Liz Ortiz.
Thanks, Liz and WBFF, for that story. Social distancing has made it harder for families to find entertainment. Going out to see a Friday night movie, not an option unless you live in driving distance of an outdoor theater. Erica Glover with Sinclair station WZ-TV found a drive-in spot right outside of Nashville that's gaining national attention.
It's all about exactly what I'm doing right now, sitting in the driver's seat, never leaving my vehicle, limiting face-to-face interaction, all while still getting out of the house to enjoy a movie. These days, the line of packed cars eager to park at the Stardust Drive-In Theater is at least a mile long.
We've seen people come as far as Clarksville.
$8.50 gets you an adult ticket to watch whatever's playing on one of 2 digital projectors.
We can park 225, 230 cars between the poles. Right now, we've got that cut in half to about 115. And so that way, when everybody parks, there's about 15 or 20 feet between each car.
In a time when social distancing restrictions are keeping some indoors.
People are aching to get out of their house.
Giving theaters like this one a resurgence of popularity.
He's the monster.
According to driveinmovie.com, about 30 drive-ins in the U.S. are still fully functional, making this business one of a kind and the closest drive-in to Nashville.
It's one of the few things you can actually do where if you don't want to interact with anybody, you don't have to.
Floyd says any other year they wouldn't be operating at this level so early on. But with classes canceled, they've gotten a jump start on a now non-stop summer season.
As soon as we got open May 1st, we went 7 nights a week.
Hoping to keep moviegoers entertained long after this pandemic passes. This drive-in near Nashville allows viewers to either bring their own snacks or use an app for easy concession stand pickup. For America This Week, I'm Erica Glover.
Thanks to Erica and WZTV, and thank you for joining me for another America This Week, United We Stand. This is Memorial Day weekend, and if you're in a state that's starting to reopen, now is the time to show them your support. And also remember the reason for this holiday weekend. We want to take a moment to thank those brave Americans who have fought for our freedoms and this great country. They've paid the ultimate sacrifice, so thank you to those American heroes and their families. Have a good night, everybody, and see you all next week.
You